People with disabilities are always excluded in development. They are never thought of as a vulnerable population, and any crisis, including COVID, worsens their condition. So as CBM, the first thing we did was to ask ourselves, what could be the effect of this on the livelihoods, on the health, and the general welfare of people with disabilities. People with disabilities could not access the services they need, could not access the general livelihoods that they had before. Some could not travel. And with that, we decided to, first of all, adjust how we work in view of the changes. One way of doing that was to adjust the programs that we are already supporting. So we engaged with the partners in all the countries that we work so that they could make adjustment given the resources they had. One example in Ethiopia, we engage, one of our partners is called the German Church School, and in that school we are promoting inclusive education. So we supported some of the families to access what we generally call bundles or internet connectivity so that they can continue accessing online education. That was one. Two, because their livelihoods were affected. They could not move, they could not sell, they could not engage in petty trade that some of the families were engaging in. We came up with a program to make sure that they could access basic items such as food. And we supported such interventions. Ordinarily, we don't directly support this. We support livelihood interventions that enable them produce food themselves or access them to empower them in the long term. But this was an emergency. All this is possible because as CBM, in order to respond to this crisis, we realized that we needed to be not just flexible, but also agile in the way we do our work. And so there is a latitude for doing new things at country level, and this has been extended to partners so that they can be more innovative to respond to the unique needs that are presenting in the settings where they work.